are going to discuss non-alcoholic fatty liver disease. This NAFLD is basically a spectrum of disease characterized by accumulation of fat in liver. If accumulation of fat exceeds 5% of the liver cells, it will be diagnosed as fatty liver. तो फैटी लीवर जो स्पेक्ट्रम होता है इसमें इट विल स्टार्ट फ्रॉम सिंपल फैटी लीवर एंड some patients may progress to non-alcoholic steatohepatitis, and some of these patients may progress to liver cirrhosis, and a fraction of these patients can ultimately develop liver cell cancer. So how common is non-alcoholic fatty liver disease? Non-alcoholic fatty liver disease in our subcontinent, it's present in around 30% of population, and it may go high up to 50% in some studies. Now, why this is common is because there is increased incidence of obesity, diabetes, which will ultimately lead to non-alcoholic fatty liver disease and cirrhosis. 20% of patients with non-alcoholic fatty liver disease will progress to non-alcoholic steatohepatitis, and 5% may progress to cirrhosis of liver. Now, why these patients with simple fatty liver progress to non-alcoholic steatohepatitis and cirrhosis is actually not fully known, but some genes have been ascribed to this for progression of NAFLD to NASH and cirrhosis. So, what are the symptoms of non-alcoholic fatty liver disease? Most of patients with non-alcoholic fatty liver disease will be asymptomatic, and the patient who present with symptoms will be having symptoms like right upper abdominal discomfort, maybe mild discomfort in liver. Some patients can have fatigability, easy fatigability. Some patients can have dyspeptic symptoms. Some patients might have itching, and ultimately some may progress to cirrhosis. They will develop complication in the form of accumulation of fluid in abdomen. Some patients may develop hepatic encephalopathy, altered sensorium. So these are the commoner symptoms in patients with non-alcoholic fatty liver disease. Now, who is likely to develop non-alcoholic fatty liver disease? There, first and foremost, is patients who are genetically predisposed to non-alcoholic fatty liver disease. There is strong familial preponderance for these patients to develop. Second is patients who are having obese, overweight patients are at 2 times risk for developing fatty liver disease. Third is patients who are diabetic. Diabetic patient again can develop fatty liver disease. Fourth one is patients who are having dyslipidemia in the form of increased triglyceride levels in blood. There will be deposition of this triglyceride in liver cells, and they will develop fatty liver disease. Then there are certain drugs, certain medicine, toxins which can predispose patient to fatty liver disease. Now, individually, diabetes, obesity, and this third one, dyslipidemia, they will increase the risk twofold for development of fatty liver disease. And if they are present, if all these three risk factors are present, patient will have 16-fold increased risk for development of fatty liver disease. Now, how is this fatty liver diagnosed? There are common. First is high index of suspicion. Patients जो obese, overweight, diabetic हैं, उनको screening होना चाहिए. And we will go for basic tests like liver function test will be designed in these patients. It's not necessary that it will be designed, but some patients will have drained liver enzymes. Some patients can have dyslipidemia in the form of increased triglyceride content in blood. Patients, once we go for routine ultrasound for maybe some other reasons, we will see that patients are having increased fat content in the liver. And once these patients are further evaluated in the form of we can go for fibroscan or sometimes liver biopsy, or in other patients we can go for special MRI like MR spectroscopy or PDFF. These are some advanced tests which are done to diagnose these patients with fatty liver disease. Again, these patients with fatty liver should be evaluated for hepatitis B and C also, because these B and C are present in 10% of the normal population, and it's not necessary that patients who are having fatty liver disease might not have hepatitis B and C. Now, important question is, how can NAFLD be managed or treated? So at present, there is no medicine which has been proved beyond doubt with a good randomized controlled trial or any guideline which favors any drug. But most important is weight loss. So if a patient is able to reduce 10% of body weight, his fatty liver can, I mean to say, improve very fast. And minimum recommended is more than 5 to 7% of weight loss is very important for these patients. And if you can increase it up to 10% of weight loss, then patients will improve very fast. Now, other measures which can be done to reduce the liver fat or balanced diet. You should take, I mean to say, increase amount of protein and reduce intake of carbohydrates and fats, so that this fat content in liver is reduced. Avoid drugs and toxin which can damage liver, and try to avoid Ayurvedic or Desi medicine, or some Chinese medicine which have been shown to damage liver. And healthy lifestyle, it should start early in life, and you should encourage your children's and adults also to maintain healthy lifestyle and do regular physical activity. Now, last is how you can make your liver stronger. uh, First and foremost, as I have already told you, that you should maintain a healthy weight. You should try to reduce weight if you are obese, and eat a balanced diet, and try to reduce fat content and carbohydrate content in liver. You can just take mixed diet, exercise regularly, and avoid toxin. And last of all, and one of the most important thing is try to avoid alcohol if you are having fatty liver.